People with Alzheimer's and their loved ones gathered at Martin Luther King Jr. Park in Columbia yesterday to demand action from either the FDA or the Center for Medicare and Medicaid Services. We have more in this report.
What do we want? Access! When do we want it?
Now! In January, the FDA granted accelerated approval for a medication used to treat the early stages of Alzheimer's. Beth Solkowski, a representative of the local Alzheimer's Association, says her organization and those they represent feel that this situation deserves more attention.
The restrictions that are currently in place are bureaucratic, to be frank. They are keeping people who desperately need these drugs yesterday from accessing treatment.
On June 1st, the Center for Medicare and Medicaid Services explained that Medicare would cover the drug if the FDA granted traditional approval. Because of the discrepancy in which kind of approval was given, patients who need the drug have to go on a registry list. Solkowski believes this registry will slow things down.
An estimated 2,000 people are progressing beyond the point of medical eligibility for this treatment while they are waiting.
And Kendall Lee says she's witnessed the progression of the disease firsthand.
This is my Meemaw. This is my father's mother who passed away 5 years ago. Her spirit, her silly, goofy personality, it just dissipated, and she would just sit there in a recliner and just stare off into the distance. This is Grandmama. This was my mother's mom, and she passed away, wow, there it is. She passed away in 2012. Something that was really interesting about Grandmama is she showed a lot of signs of the disease for a few years prior to her diagnosis.
Lee, like several others, attended Saturday's rally, hoping for better on behalf of their loved ones lost to Alzheimer's.
These patients can get this treatment. It's not only going to give them their memories and a better quality of life for more time, but it's also going to relieve some of that burden from caregivers for a lot longer.
This rally was one of 50 that took place across the United States this weekend. Reporting in Columbia, Peyton Lewis, News 19 WLTX.
According to the FDA's website, as of now, there are no plans for the FDA Advisory Board to meet again until June 28th, and even then, they will not be discussing drugs related to Alzheimer's. Of course, we'll continue to keep you updated as this story develops, not only on air, but also online at WLTX.com. In January, the Food and Drug Administration moved to fast-track the second drug that could help slow the progression of Alzheimer's. This is only the second drug ever approved that changes the course of Alzheimer's by slowing its progression at the early stages of the disease, giving people more time to participate in daily life and live independently. Nationwide, more than 6 million Americans are living with Alzheimer's, and currently there is no cure. This month, DHEC is bringing awareness to the disease. In 2020, 95,000 people in the state 65 or older had an Alzheimer's or dementia diagnosis. By 2025, that number is estimated to increase by 26.3%. And more women are impacted by the disease than men. Women make up 63% of South Carolinians with Alzheimer's or dementia-related diseases.